Hello, welcome back to our first podcast episode for 2025. We've had a bit of a break. Thank you for joining us again. And what a way to start the year. Today's episode is myself chatting to somebody by the name of Gavin Kervill, who's an acupuncturist from the UK. And it's interesting how this conversation evolves. So, we have been advertising for a little while now that we're going to be running a dry needling course in the UK. And in one of the posts that we promoted the course through, Gavin came on with quite some strong opposition to the idea of dry needling and the course that we were promoting. And he had some fairly stern words to share. And so through that conversation, I invited him on to this chat to have a conversation with us to dive in a little bit deeper into the differences and the similarities and some of the challenges that exist between dry needling and acupuncture. So I hope you enjoy this conversation. I think you'll find it very interesting to see where it ends up at the end. Once again, thank you for tuning in to Ace Audio. Enjoy. All right, Gavin, thank you for joining us today. Hopefully this will be an interesting conversation for everybody tuning in. We might start, I think, by you introducing yourself to the audience, telling us a little bit about who you are, what you do, and then maybe how this conversation came about, some of the challenges in perception that we may have.
Sure, absolutely. I'm an acupuncturist, traditional acupuncturist, been practicing 14 years. Just returned to the UK from the Cayman Islands, been working there for 8 years with a doctor, doing various treatments for stem cell therapy, for multiple sclerosis right now. A lot of trials going on. And yeah, some very interesting work out there. So basically how this came about, I've returned to the UK, I've opened a couple of clinics here, and we are faced with a challenge here as traditional acupuncturists. And sadly, there's a little bit of a crossover with where you are and what you're doing in terms of dry needling.
Okay. Yeah, great. So that is I think it's a bit of a universal challenge. I've certainly been paying close attention to the differences of opinion and the differences of, I guess, perspective between acupuncture and dry needling around the world. I think this has become a bit of a universal issue. We see it as being a fairly obvious one in the US, where there's certain states of the US where people are allowed to dry needle and others where they are not. And that's largely because Chinese medicine has lobbied to have it, I guess, outlawed, for want of a better term. And then currently that's changing bit by bit, state by state in the US. It's even happened here in Australia, but obviously that stems from a challenge in understanding about what is dry needling, what is acupuncture, and probably a lot of misconceptions in the general public, I'd say, about them being the same thing. And I think we both agree they're not the same thing.
Yeah, and I think, and that's I think the challenge as well is that there's a certain amount of people that are just going to assume if you're using an acupuncture needle, then you're giving them acupuncture. Much like if I was to give someone an exercise to do in my clinic, then to suggest that was physiotherapy might be a bit strange, and I might get a few people pull me up on that.
Absolutely, yeah. So I noticed you've got an interesting website. Looks like you've had lots of interesting experience across the world using acupuncture and Chinese medicine in different ways. I noticed that you state that you use dry needling in addition to acupuncture. Can you give us your perspective on the differences between the two approaches?
I would describe dry needling as a collection of trigger points used under 50, I believe, which might initiate a response or a trigger response or a healing response in the body. Typically used for sports injuries, I find from what I've heard as being successful. More of waking up with a stiff neck and the muscles in spasm, and for a good release, basically. In terms of what I do with dry needling, I wouldn't say I use it very often at all. If anything, you might say that a couple of the points that I use, trigger points for, would be for sciatica, would be the main use that I would say. But you could also, in Chinese medicine, call that an Asher point, which would be the same thing.
Okay. Yeah, gotcha. So that's interesting, isn't it? That we all have different definitions around what one thing is. Like for example, you just mentioned that trigger point therapy, or sorry, dry needling therapy, in the context that you use it, focuses on specific trigger point locations, and you mentioned maybe 50 or less of those. Whereas we would look at trigger point therapy or dry needling as being the treatment of trigger points, but also the use of needles to impact or interface with a range of different tissues in the body, and that there's actually no limit to the number of trigger points that somebody could have. and there's certainly no specific map to where they're found. So
Right.
I guess we all use these terms, dry needling, but depending on the training we've had or the perspective we're coming from, we might define them as different things. And so,
Yeah.
for those who aren't familiar with Chinese medicine, you mentioned Ashur points and them being similar to trigger points. Can you explain from the Chinese medicine perspective what an Ashur point is?
An Asher point would be a point that's very responsive. So if you're palpating and a patient says "ouch," then that's usually, Asher means that's it.
Okay,
So that's the one that's it.
gotcha.
Yeah.
And would you consider dry needling something that's traditionally taught and a component of acupuncture, or it's a separate modality?
It's I wouldn't say that it's either. In effect, my understanding is that dry needling was a group of physiotherapists from the UK travelled to China to see acupuncture, couldn't prove the efficacies of all of the claims that were made for treatment, and so adopted the simple small part, which was to use a point which is tender or responsive, and needle it to get a response, and that being it. But in terms of Chinese medicine, I would say it's rare to see someone use one needle, one point, and then send the patient on their way. It's more of a collection of points, because the whole ethos of Chinese medicine is to, or the philosophy of Chinese medicine is to treat the root. So we're not just looking at what's hurting; we're looking at why that's been caused to hurt, or why the body has allowed that to happen. We look at a lot of circulation, at deficiencies in the blood. We look at very small symptoms, like if I have a patient come in, for example, and this is where we differ quite a bit. If we have a patient with shoulder pain, I might wonder why the patient has a shoulder pain if the muscles are getting what they need. And in terms of that, asking the patient if they struggle with any postural dizziness, any floaters, any cramps, twitches, and spasms, and then we would confirm that information with what we find on the pulse and the tongue. And if we find that, then we'd then be looking at the how to treat the blood, and also the individual person as to what part of that process has gone out of whack with that patient in particular.
Yeah, right. Chinese
Um,
medicine's a fascinating thing, isn't it? It's so complex. There's a
it's
lot
very
to it.
complex. Yeah,
Yeah.
I think the one hope I would hope for this meeting is to help some of the physiotherapists and chiropractors understand that there is a huge difference. And I mean, I think one struggle that we have as traditional Chinese medicine practitioners is that, for example, you won't ever hear me use the term qi or energy in my clinic, because I know that turns people off straight away, and it's very much an Eastern concept. And in fact, I think it's a very misunderstood concept, because actually, you could almost think of it more of an analogy. And where I've kind of spoken to the doctors before and explained this chi or energy that runs through the body, and they'll just roll their eyes at me, and and I've lost them. But in actual fact, that chi it's an analogy for nutrients in the blood, for an electrical stimulus in the heart to tell it when to beat, for the hormones, for chemical exchanges, for energetic exchanges, and things that happen in the body. And it's actually, when you look at it like that, it's actually a very intelligent ideology and way of understanding a very complex thing, which is the human body.
Absolutely. And look, I have a great appreciation for Chinese medicine. I studied it for a year, right, which is not very long. But in
Right.
that year, I understood that I learned about meridian theory, the five element
Yeah.
theory, yin and yang concept, and energy
Right.
and blood pathway, tongue pulse diagnosis, all of those things. And in that 12 months of study, I realized that 12 months of study is not anywhere near enough to understand Chinese medicine. That's the one thing I took away
Yeah.
from it. I did a Twinar certificate, and
Yeah.
so the manual therapy side of Chinese medicine. And through that, yeah, developed a deep appreciation for Chinese medicine and all the things that it can achieve. And I also came to realize that it is a whole system of medicine. It
Yeah.
has existed for thousands of years in the East. And
Yeah.
it is a system. It's a whole, the whole body can be treated through Chinese medicine, and
Yeah.
acupuncture being one of the tools that is used to influence those systems within the body. So
Yeah.
where do you see the biggest challenge or I guess issue that exists between acupuncture and dry needling in the world at the moment?
I think I would say it's public perception. So I've worked with chiropractors and physios. I worked at a very busy physiotherapy clinic in the Cayman Islands, alongside some wonderful physios and wonderful people. A lot of them are very good, and they will clearly describe to the patient and very clearly state that it's not acupuncture. This is dry needling. But there's a it's a very, very fine line with that crossover. And there's a lot of people, certainly in the UK, where if you look on the NHS website, they will describe acupuncture as what the physiotherapies at the NHS do, and that's dry needling. So even within our NHS, there's a real problem with differentiating. And as I said, there's a communication issue as well, and as I said, sometimes the more we talk about chi and energy, then the more people are not going to take us seriously, and we have to find a way to explain it for Western ears, because and when it comes down to the research, it's been very much a battle of trying to understand how we measure this thing, because it is, as you now know after you study this, it's very complex, and it's not as simple as assigning a number to an outcome.
Right, oh, that's right. That is the challenge we face too. And look, we've done our investigation into dry needling and the way that it's taught across the world, so that we can better understand
Yeah.
how everybody does it. And we've very much come to realize that in the UK, you face probably even a bigger challenge than we do here in Australia. While the same misunderstanding of paradigm does exist here in Australia, where we have acupuncturists and dry needlers, and they might sort of cross lines with terminology and the way they
Yeah.
present themselves. And that certainly presents its challenge, and it has for a long time. But in the UK, I think it's even greater. From what I understand, Western medical acupuncture is the term that's often used, or Western acupuncture, and that's typically how it's taught, which from my understanding is, and please correct me if you see this differently, but we'll have somebody teaching a course in dry needling or Western acupuncture, but they take a little bit of Chinese medicine and they sprinkle it onto some understanding of biomedical
Yeah.
physiology, and then sort of blend those two things together. And then we have people that are trained in manual therapies, physio, osteo, chiro, those sort of things, sports therapists, who are then picking out specific acupuncture points,
Yeah.
and needling those
Exactly.
to reduce neck pain and hip pain and back pain and so on. Is that
Yeah.
am I
And
right in that understanding?
that's right. That's absolutely right. And what they're doing is they're actually trying to treat Chinese medicine like a cookbook, and
Yes.
it's not a cookbook. And as you know, it's there's many layers to the diagnosis, and they all have to add up. We don't just say, oh, the neck hurts. Well, that must just be, just use whatever point. It doesn't work like that. And as you know, there's other things like Asher points. There's palpating. There's feeling the temperature between 2 points. It's very, very complex. And I think the trouble is that there is a lot of confusion, and like you say, there's a lot of courses happening where people sprinkle little bits in and they call it medical acupuncture because it's making it trying to sound like it's something that it's not. And actually, from our perspective, if I can maybe speak for a few acupuncturists on our side, that to call it that is it's not medical, and actually what we're doing would be viewed as more medical, because I'm treating women's health, I'm treating stroke recovery. There's not much that in the way of patients that I don't see, and if people could see some of the outcomes that we get, some of these doctors would be truly amazed what we're doing with acupuncture. And as for me, I grew up in a family of doctors. My mum was a nurse, midwife, and a lecturer. So I've always been surrounded by Western medicine, had a lot of respect for it. But it's very difficult, because it's something I care about a lot, and people don't really understand how they're mistreating it and how they're misselling it, and the damage that does to us as a industry.
Yeah, yeah. I completely empathise with you in that situation. From the outside looking in, for the general public, they'll see somebody with needles in them and they think, well, that must be acupuncture, because that's what we typically consider to be acupuncture. But we can see people using needles in other ways to achieve other things without the use of any Chinese medicine principles. And those two things, in my mind, can coexist. as being separate, and it's when you try to blend the two that we have issues. I'm a
Yeah,
really strong advocate for not combining the two paradigms, not because I think one is more valuable than the other, but I think when you try to combine them, you water down both. And
exactly.
I don't think dry needling is a whole system of medicine. I think dry needling is a modality or a skill set that somebody who has a whole system of medicine as their undergraduate qualification can add on top and
Yep,
use that tool to treat very specific things. And it's a very limited number of things in comparison to
yeah,
Chinese medicine. You
yeah,
talked earlier about how your understanding how dry needling evolved. A group of physiotherapists learning from acupuncture couldn't understand it and couldn't explain it, so that they just used selective points and so on. I think actually I have a different perspective on that, and we've got quite a bit of research that we cite with around the evolution of dry needling in Europe in particular. And
right.
and I think that nice analogy, and one of our colleagues shared this one with me the other day, is like I think a lot of people look at acupuncture and they look at dry needling and they think, well, it evolved from that. It was like a progression. And the dry needling
Right.
is the modern interpretation, which I completely disagree with. In the same way
Yeah,
that a motorcycle didn't evolve from a car. They both have engines, they both have wheels, but a motorcycle
yeah,
evolved from a wagon. Sorry, a car evolved from a wagon, a motorcycle evolved from a bicycle. They both
mhm,
appeared in the world through different trajectories. And we
yeah,
could look at the two and go, well, they're both vehicles, they both have engines, they both move people, they're the same thing. Acupuncture and dry needling are the same thing, but no, they actually evolved separately. If we look back in the history of back in the early mid 1900s, we saw people doing research in the West, unrelated to Chinese medicine, where they were injecting tender points in the body. I guess in Chinese medicine we call those usher points, um, tender points before they were called trigger points. And then
mhm,
they found, well, what if we didn't inject them? What if we just used the hypodermic needle and stimulated the tissue? And they still got a result. And they thought, well, what if we try to disturb the tissue even less and just use an acupuncture type needle? And that still worked. And so they found the lowest minimal viable dosage of stimulation to reduce the pain symptoms without involving any Chinese medicine principles or acupuncture points. And so I just find it fascinating that we have these different perspectives. And I guess depending on where we studied, who we learned from, the country we grew up
mm,
in, all of these things, we have different stories that sort of tell us how things evolve, which is it's fascinating for me. Um,
absolutely.
yeah.
I
So
think for me the analogy would and always has been and I if when I speak to people about therapists that call dry needling acupuncture, I would refer it as a first aider claiming to be a GP, um, because it's it is a more simpler tool. It is a modality, and it's a great modality. And it's like I say, it's one that I would use here and there as well. There's some useful points that might go to and just use before I do a full blown traditional treatment. But yeah, it's very difficult, and it's very difficult to get people to understand the difference. And also, something I come across a lot, and I had a patient the other day say it to me. Is I just don't understand how a needle can do all that. Um, and it's a very common, it's a very common thing. And I think the trouble is that the explanations aren't there from our side very much. And in actual fact, the nervous system does control hormones. It does control it controls temperature and blood pressure and heartbeat regulation, virtually everything that goes on in the body. And as our take on traditional acupuncture is that these tender points that were found were cross-referenced, and they noticed what these points were doing each time, that certain symptoms came up, and that when certain symptoms came up, these certain points were tender. So, like a sore throat or something like that, then lung 7 seemed to be really tender. So they stimulated that and found that, to get past the frequency of the skin with the needle, or at the time, a sharpened shard of bone, was even more effective. So it kind of sounds like there's a big crossover with stories, and it's even confusing for both of us, I think, sometimes to understand which stories came from where. So I can only imagine how the general public struggle sometimes.
that's right. Yeah.
Um,
And I get that's why it's so important for us, I think, to lean into the research and try to understand what does the science actually tell us. And you mentioned these fixed locations of points in acupuncture. And for a long time, it was perpetuated that there was a crossover, 76.8 or 78.6%, I can't recall, of
yeah,
crossover between where we find trigger points and where we find acupuncture points. But now
Yeah.
the common held understanding is that there are no fixed location for trigger points. And in fact, it's pointless trying to learn the exact location. We're better off palpating for these tender points and needling where
Right.
appropriate rather than trying to identify specific locations. Whereas in acupuncture, the opposite is true. There are fixed locations. They've been mapped and they've been used for thousands of years and with great effectiveness.
Yeah.
And so that in itself is a paradigm difference, I think, between the two. Is one is based on a map of the body, and that map would indicate specific functional connections to different parts of the body and how we can influence those functions. And the other one is based on physiology that changes over time based on symptoms, and
Yeah.
then we use that physiology to determine where the needle might go. But the only thing I think, well, at least in my mind, the only thing that acupuncture and dry needle share is the use of a steel needle, a solid filament needle,
Yeah.
and this is part and parcel of why we're chatting today, is because the perception in the general public is not that. They think the needle is the key component, and just putting it in the body is how we achieve the outcome. But it's two very different systems of medicine and understanding of the body, and showing
Yeah.
respect on both sides, which I think is key.
Absolutely. Yeah. Yeah. It's a very strange paradigm as well. It's a very difficult thing. I always pose the question when someone asks me, well, how does that even work? And I'm, well, do you know how an antibiotic works? I can guarantee you they don't most of the time, but for some
Yeah.
reason they have to understand why something that seems more strange might do it.
Mm.
But even, I even come across a lot of doctors that don't understand how it could work. And when I spend 10 minutes and have a conversation, they're like, actually, when you say it like that, it all makes complete sense now. And I think the trouble is that there needs to be education, and we need some kind of public advertisement, some kind of campaign for public awareness, really. And the trouble is that the British Acupuncture doesn't have the funding, council doesn't have the funding for that, and it's not in the interest of the NHS for some reason. Which is a strange thing for me. I'm actually struggling to get referrals from GPs here. Where in the Cayman Islands, 80% of my work was on referrals. I had gynecologists sending me insurance-covered referrals for promoting labour and things like that, which in the UK would never be heard of. I think Australia is a lot better off in terms of this than the UK. And I know that you guys were using acupuncture in hospitals long before we were, and it was saving you millions a year. It would be wonderful if we managed to get the same here. When I started looking into studying, I actually consulted the British Acupuncture Council, who at the time said that the idea was that we were going to get protection on our title, which is ultimately what we need. That pretty soon we would have probably salaried jobs in the NHS. And unfortunately, what happened was that all that work went to the physios and chiropractors. So I was told to do my degree because that was the best thing, but it wasn't the best thing.
Right.
And
Yep.
now we're struggling because you can only really be self-employed as an acupuncturist here. So it's tricky, and I've come across struggles with working with physios as well. I was sharing a patient with a UK physio actually in the Cayman Islands, and I was treating this patient for fertility. She'd not had her period for 2 weeks. She was 2 weeks late. And on this appointment, I was getting ready to tell her, if it still hadn't arrived, that she should go and get her pregnancy test. And I was excited to tell her that. And instead, when she came up, she said, "Oh, I've just seen the physio. He's just put some needles in my shoulder." And I was like, "Oh, where did he put them?" And she pointed out, well, 3 points on her body, which are contraindicated in pregnancy and can cause miscarriage. And I gently pulled the physio to one side and explained why he's got to try and stay in his lane a bit. And it didn't go down well. There was a lot of arguments, and we didn't, and it's ludicrous. But there needs to be a bit of respect on both sides, and that starts with clearly stating that what you do is not acupuncture; it's dry needling.
I 100% agree with that last point. That's the key bit. And so we came to meet each other through some comments that you'd made on one of our social media posts about we were advertising the fact that we were planning to run a dry needling course in the UK for the first time.
Yeah.
And yeah, you had some fairly strong words about your opposition to dry needling, and I understand why. Look, I have full respect for that,
Yeah.
and I understand the plight of the acupuncturist, because I think it's a universal challenge when we have two modalities that kind of look similar from the outside looking in, but obviously
Yeah.
aren't for the educated eye. I want to talk to that a little bit. So, what do you see as the biggest issue for people learning dry needling now? What would you like to see change?
What would I like to see change?
Or would
I
you
would
like to
just
just
like
see it
to.
not happen at all? That's another question.
I've got no issues with it happening. I mean, my aim is there for the patient, and it's a great modality. It's not taking opiates, which I'm a big fan of, and there's just ways of doing it, I think. And I think if we had a protected title, and it was very clearly stated the difference, and we were, because I'm qualified to the point, so I'm on the professional standards authority register. So the BACC is. So I'm of the standard that can be referred to by a doctor, but I don't get referrals, and this is what needs to change. There's a lot of patients that I have no issue if someone's got a bad shoulder and they go to physio instead of me, because I'd much rather be treating the patient with fibromyalgia or something that medicine can't, and really does struggle to address, because I know I'm going to make some big changes for someone. And so, I think there's more than enough people for all of us. In fact, there's too many anyway. So, and that's part of the problem. And I think that's why we need to be introduced into general care more here. And people need to see that the standards are good as well. I mean, the trouble here is that I'm finding now is that there's now a diploma course being taught a lot more here, and I've worked alongside some acupuncturists on diploma courses. One of my friends had a diploma from Canada, and she was always asking me questions and saying, "Oh, I wish I'd done the degree, and you just know so much more than me." And it's a very basic course. And there just needs to be a clearer separation, distinction between the different levels of training and what that means. And I think further to that, in Canada, they run a diploma course called a TCMD. So they teach a little bit of acupuncture and a little bit of herbs and a little bit of theory. And the TCMD stands for doctor. And so the problem I came up against in the Cayman Islands was one of those actually using DR in front of her name after completing a 1-year course. Now, I've done a 6-year degree, so I wasn't going to let that stand. It's not okay in any profession. And I don't know what standard you have there, but in England here, if you have someone do your plumbing, they have to be Corgi registered, and that's very serious. And if someone's not doing that, they can get heavily fined or into a lot of trouble. And it just disappoints me sometimes that the medical industry isn't as clear and distinct and strict sometimes, and it's a shortcoming.
It is, absolutely. And we do have the advantage here in Australia of having protection of title for acupuncturists and Chinese medicine practitioners. That is
That's awesome.
certainly an advantage. But at the same time, I know a lot of acupuncturists who have got that protection of title now. It only started back in, I think, 2012.
Yeah.
But since then have found that registration with AHPRA, as the registering body over here, has not actually benefited them greatly either. Like they haven't had, even with that, it hasn't stopped the issue about perception. I can't call myself an acupuncturist, and I never would in a million years, but I can't do that legally here. And I think that's correct. I think that's the right way to do things. But other people could go and call themselves a dry needling practitioner, which I don't think is a thing anyway. It's a skill set that sits on top of another qualification. It's not the type of practitioner, but that is legal. Anybody could do that even without any kind of formal training. So that is a protection of title issue for someone like myself. But that is certainly a challenge that particularly acupuncturists face. Some of the comments you were making that sort of started this conversation between us were things like you were very strongly advising people not to do a dry needling course, that if they wanted to learn how to needle, they should do an acupuncture course. Can you talk to more about that?
Yeah, absolutely. I'm trying to think what the context was now. But yeah, I mean, I feel like nowadays there's a lot of people flocking for dry needling. I don't see it as if I was a patient, knowing what I know, I would I would recommend a friend to go for traditional acupuncture,
Mhm.
because if I want the plumbing done, I don't phone a handyman, you know. And if I want physio, I would go to a physiotherapist, a chiropractor. I don't. I've had physios try and manipulate me before. I don't want them to. I came for physiotherapy. Maybe that's just how I feel. I don't know. But I know there's a few other acupuncturists that I'm familiar with that feel very much the same.
Yeah.
Um,
Do you think that comes from the idea that so many people are using and teaching dry needling as that watered down version of acupuncture, as like sprinkling those
yeah.
two things together? Yeah.
I do, yeah, and I have to give benefit to you. You seem to be doing much better than most schools that I come across, and it's really encouraging to see. And just the fact that you're willing to talk about this as well. But yeah, I do feel sometimes like I don't see, yeah, I don't see what you could do that we couldn't in a sense,
No,
you know.
I don't
Um,
either. I
and
don't
in a
think one
way,
is better than the other.
no, no, absolutely. And I don't know. There's a lot of therapies I see. Cupping as well. Cupping therapy is a lot of massage therapists just buying cups and doing their thing with them, making pretty patterns on people. And it's there is some theory to it. There's patients that I have that if I do cupping to, they're going to have a massive flare up, and it's not going to help them at all. And there's people just doing wild things like how they feel. And because they don't understand all the theory to it, they just assume it's simple. So yeah, it's a tricky one.
It
Yeah,
is. There's cowboys in every industry, right? That people will just take
yeah,
a tool, a skill set, a little piece of knowledge and think that that's useful, but it can be dangerous. A small amount of knowledge
yeah,
can be dangerous. So cupping's another
yeah.
great example of that. That's a modality that I teach, but I don't teach it from Chinese medicine perspective, even that's how I first learned it.
Right.
I've moved away from, and intentionally, just like I have with dry needling, moved away from Chinese medicine because if you apply that concept, that the principles within Chinese medicine, it does require a much greater and deeper understanding. But if you apply it
Yeah.
from a Western myofascial only perspective and stack that skill set on top of your understanding of physiology, anatomy, and
Mm,
pathophysiology, then it can be done safely, but only if it's done in that way. I think that's the key bit.
right. But
Yeah.
would you use it on a patient with deficient conditions?
Explain deficient conditions for me.
That's the trouble. You
But
see,
can you explain to me?
a
Yeah.
deficient condition in terms of Chinese medicine would be a pain that's dull and achy that gets worse with movement, with use. Something that needs strengthening and like a weak lower back, if you like. But we have different needle techniques and different points to do introduce sort of more blood flow and what have you to the area, and these points just have different actions, and the needling techniques have different actions. And I would love to say it's all hocus pocus, but I can do it wrong sometimes, and if someone will say to me quite often, and this works the same as what we're talking about, oh, that's just placebo. Well, the trouble is that I can I can put them in if that was the case, I'd put it in the same place every time and it would work, right? So I've done, even if I do an even technique on a patient that has a deficient condition, then it's probably going to make it worse.
Right.
If I need the needle in too long, it's going to make it worse. And, patients with fibromyalgia, patients that have chronic fatigue, conditions like that are very delicate, and it doesn't take much to push them too far the other way. And cupping and acupuncture are both things like that I have at times felt like kind of doing things that they're not quite understanding can actually cause some harm if it's done wrong.
Absolutely.
Um,
Yeah. No, I think that
so,
you make an interesting point there. I think the idea that if all you have is a hammer, eventually everything starts to look like a nail, right? You just start hitting everything. And so if all you
exactly.
have is a set of cups, or if all you have is a needle, then you want to cup and needle everything, and that's
Yeah,
certainly not the case. Interesting. The
absolutely.
deficient definition that you just described to me sounded a lot like an inflammatory condition from a Western medical perspective. Dull and achy
Right.
is made worse with movement, that kind of thing. So
Right.
if something's acutely inflamed, would I cup it? No. Would I needle it? No. As
Well,
it evolves into different phases of recovery and goes through that healing
yeah,
process, there might be a time that's appropriate, but dosage is key. and also
Right.
patient's current and very specific situation to them all needs to be considered when you formulate that treatment plan and select the
Right.
appropriate modalities used.
But a full condition, an empty condition isn't inflammatory. Inflammation is a full condition. So for us, that would be tender with pressure. An empty condition would feel better with pressure. So certain types of arthritis, or certain types of pains from a deficient condition like fibromyalgia, or some kind of CFS. Yeah, it's slightly different to that. So in fact, on an inflammatory condition, I would be using more of a reducing technique. But also, that's very vague, and I'm just talking very vaguely because it very much depends on the patient and how bad it is and how long it's been there and all these other factors that you have to check the tongue and the pulse and everything else and see where the root of it is and which part of it is the cause. It's very, very difficult. So it's complicated because I speak to a lot of physios about acupuncture, and some will argue with me and say they do acupuncture, and I say, okay, well, what needle technique are you using on this person? And they look at me like, needle technique, and that just concerns me because it means that they don't know, and that means that essentially that there's parts they're missing, and that there could be some harm that's going on, or at the very least, the patient could be getting better relief from someone with more training.
Interesting. Yeah. So, and I think a lot of that comes down to terminology used, and you talk about empty and full conditions and so on. And when you use that language, someone coming from my perspective doesn't understand what you mean by
Yeah.
that. But
Yeah.
likewise, I could talk about the diagnostic procedure that I would follow with a patient with the same clinical presentation, and how I might or might not use needling, dry
Yeah.
cupping, or joint or corrective exercise or something like that. And
Right.
then that language might seem foreign to you, and you'd be like, well, that's incorrect. But we both get results. We both achieve
I'd like
outcomes.
to. I would like to agree with you. Yeah, I think. Yeah, I think if there's some healthy crossover is good. So in terms of my training with the degree I did, we had a lot of physiology, anatomy, pathophysiology. We had to do red flags. We had to do Western medications. We had to understand all of that because quite often, as someone that treats a lot of things, I get a lot of patients that come to me and don't want to see the doctor, and sometimes I have to kick them in the butt and tell them to. So it's very important for us to be using Western clinical skills as well, and diagnosis, because we have to understand both sides in order to treat it. And also, if we're going to communicate this with the doctor, then we need to understand that too. Red flags is very important for us, but also we do monitor blood pressure, peak flow, virtually a lot of things that you would see in the GP surgery done by a nurse. And actually, a lot of people don't realize the Western clinical skills that we do have. And that's another thing that should be, more publicized from our point of view.
Absolutely. Certainly more modern acupuncture and Chinese medicine courses do involve a lot more of that. I had the great fortune of teaching anatomy within an acupuncture degree in Australia for a number of years ago. So I got to teach the
Right.
acupuncture component of the acupuncture, sorry, the anatomy component of the acupuncture degree. And it was interesting
Right.
because I was teaching acupuncture students in one class, and I was teaching myotherapist students, which I guess is a bit like a physiotherapy qualification
Yeah.
in the UK, in another class, the same subject, but for the same students in, I think, their first or second year. And the interest and focus was vastly different from one group to the other. I could see in
Right.
the myotherapy group, the anatomy, so they realized it was the foundational key component of where they needed to go and what they were going to learn next. The
Right.
acupuncturists were learning it like, okay, this will help me identify the location of these points. And the
Oh,
interest
okay. Right.
wasn't to the same degree. And I found that
Yeah.
fascinating. Even though, both practitioners would be learning to insert needles into the body for different reasons,
Yeah.
with the same potential risks. There's still potential risk of a pneumothorax. We still
Yep.
could puncture an artery. We still could contact a nerve.
Yeah.
All of those things existed. But the focus for the acupuncturist seemed to be a bit more functional, and the
Yeah.
focus for the myotherapist was more structural. It's like, I want to know where the things are, and the acupuncturist wanted just to know how the things worked. And
Okay.
that for me was
Yeah.
an interesting paradigm difference between the
It's
two.
interesting.
It is interesting,
Yeah.
yeah.
It is interesting.
Um, and so I think I know a lot of people have commented about the idea that you can learn dry needling in such a short space of time. You can learn it in a few days, right?
Yeah.
And that's a real point of conjecture for a lot of acupuncturists who spend 4, 5, 6 years, learning how to do Chinese medicine acupuncture. But I
Yeah, well,
would
not
argue,
just not sorry. Not just that, but I mean, I had to do 6 months working in a clinic, supervised by lecturers, doing treating from start to finish. I had patients. I had to bring back case studies. I had to work through those with my lecturers. They suggested points that I would use, dangerous points to needle, and I had to do those supervised for 6 months. And that's, I think, my biggest issue with the difference in training. And I have, in the place I've just been working, not the company, but in another clinic, another therapist, I won't say which type, but 3 pneumothoraxes in the last 3 years. And that's frightening. And he's still practicing.
that's more than
And
frightening. That's unacceptable.
it's completely unacceptable. And I'm just concerned with the amount of supervised clinical time that some people doing dry needling have. That's all.
I understand.
Yeah.
Yeah. I guess to my point I was trying to make there is, which is that, I don't think anybody learns dry needling as a system of care, and it's not really a system of care. It's a technique. It's a tool. Nobody learns that in 2 or 3 or 4 days or 2 weekends or whatever it might be. What they learn is how to safely insert needle into anatomy that they already understand quite well,
Yeah.
using physiology and diagnostic procedures that they already understand quite well because they have an undergraduate
Absolutely.
qualification in whatever they have.
Yeah.
And again, coming back to our early point, it's like if I was to teach somebody, here's a set of 60 different acupuncture points that you can use to treat fibromyalgia and headache and menstrual issues and reproductive disorders and so on, then the risk goes up astronomically, because people are just choosing points based on a location, and then saying, well,
Yeah.
if I needle this point, well, I can resolve your
Yeah.
physiological problems.
Yeah.
That's
That's cooked with
that's an
acupuncture. Yeah.
insult to Chinese medicine.
It is.
It's
Yeah.
also an insult to Western
Yeah.
medicine, because if you understand Western
Yeah.
medicine to a great degree and only a little bit of that Chinese medicine principle, how can you reconcile both of those theories together in your head at the same time and go, well, that makes sense. I'll put it in that spot and that'll fix that
Yeah.
issue. When everything I learned in my degree or diploma or whatever I did tells me that I need to do blood analysis, I need to do
Yeah.
surgical interventions, I might need to do some kind of, some other more
Yeah.
Western biomedical approach.
Yeah.
It's not doing anyone a service.
Yeah.
And so
Wouldn't it be
I
wonderful
think,
if it was that easy?
yeah, absolutely. And so I think somebody can learn dry needling in a short space of time, providing they have a great detailed understanding of the human body from a Western medical perspective, and they're
Yeah.
only using the needle to stimulate the nervous system to produce a chemical or neurological or mechanical change in tissue that would potentially reduce someone's pain experience. And that's from my perspective is what dry needling does. It doesn't
Okay.
influence somebody's reproductive issues. It doesn't influence digestion. It doesn't influence sleep patterns. It doesn't do any of those things.
Yeah.
It's a tool to influence somebody's pain, typically, and maybe some function. It has limitations, but it's very effective at that when you do it with the skilled application that it
Absolutely.
requires. Mm.
I think my only concern is that it's a very fine line between the people that between telling someone don't go and do that, and then doing it for a while and thinking, I could do this, and that's something you have no control over, sadly, and that is going to be an effect on the patient and on people like me. And there's not much that can be done about that. And that's just the trouble with introducing a mode of something that's very similar to an entire practice of something else. If I opened a GP surgery down the road and I hired a doctor that could only prescribe one type of antibiotic, and he was giving that antibiotic for every type of infection, it's not going to be very effective. And that's kind of how I think you're going to have trouble helping me see it any other way than that.
Well, scope of practice is an important topic. Absolutely. We have a lot of crossover with a lot of different modalities across a lot of professions. So we have Chinese medicine practitioners using Tuina massage. We have practitioners like me using massage. We have osteopaths that might use massage. We have physiotherapists that use massage. Everybody
Yeah.
uses the same tool, and maybe explains or chooses that tool as a clinical intervention for different reasons. Do you see the same challenge with other modalities? So osteopaths, chiropractors, physiotherapists all mobilize joints. Massage therapists could learn to mobilize a joint, but some of them might figure out that, oh, if they push a bit harder and move it a bit faster, that we can manipulate the joint. We can provide a cavitation, a
Very
crack of
true.
the joint. Yep.
It's very
Should
true.
they do
Yeah.
it? No. Are they legally able to do it? In most cases, no. But some people do it anyway. Do you
Yeah.
think that's the same problem that we said that you're talking about with, someone who's doing dry needling and then maybe just tinkers with a bit of acupuncture and figures, well, I could just do that anyway?
I think it's a finer line, but I think you've got a very valid point. Yeah.
Okay.
I
And
do think it's a finer line, though. Yeah.
yeah, in what way do you mean fine line?
Well, I mean, it's I guess in terms of the difference. I mean, it's if a physio is taught to do a manipulation and maybe pushing a little bit harder, does that make it a chiropractic adjustment? Or doing a bit of massage before the adjustment, does that make it an osteopathic adjustment? I'm not sure. I don't know the difference on that. But it seems wildly different in terms of this compared.
Yeah. Well, I guess the that comes down to, again, perception. I know we have a lot of crossover between these modalities, and a lot of our patients would probably come and see you, and then they'll be on their phone to a colleague in the waiting room. They go, I'm here to see my doctor, or I'm here to see my physio, or whatever, because the way that you treat might be similar in some ways to those practitioners. I've had the same thing happen to me. I think it's quite common, and so to a large degree, I think that we get caught up in title. A lot of the time, and where that's not really important. I think what is important is that we achieve outcomes for our patients. But more importantly is making sure that the treatments that we do are safe. And I'm with you absolutely on the idea that people shouldn't be blending different concepts, different ideas, and thinking that that's the best version of that concept or idea. But I do believe that each of those concepts and each of those ideas that we use in our various different health practices do hold value. And when provided with respect and care and appropriate training, can be very useful. And this is the issue I think we find with a lot of the schism between acupuncture and dry needling, at least from my perspective, is that a lot of acupuncturists don't fully understand what dry needling is, and most dry needlers don't fully understand what acupuncturist is, and so they just sort of look at the other and go, well, that's wrong, it's outdated, or it's watered down, and it's a poor man's version of, and so that lack of understanding and respect is like the division between religions. If we take it to the extreme, there's no one right religion. It's what you believe to be true, and they can all serve a purpose, just like all forms of medicine can serve a purpose. It's when if you take a Buddhist who practices a little bit of Christianity and a little bit of something else, and then what are they doing? When nobody knows. It does start with education. It starts with being really clear about what you do as a practitioner, not claiming to be something else. Not claiming to be a dry needler who does acupuncture or does a little bit of a Western acupuncture. I think that's a terrible term. And at the same time, if someone's doing acupuncture and they're practicing using some dry needling techniques, being very specific and say, this is not acupuncture. I'm using this needle to influence a tender point in muscle to reduce your pain. I'm not talking about the flow of chi or blood or anything like that. It's from a Western perspective. And I think that division. Normally division's a bad thing, but I think in this case it's creating separation of paradigm. And that makes it much clearer and easier for everybody involved.
Yeah, I totally agree.
Okay. Yeah. So what's the solution? What's the solution, Gavin?
I think, as you say, I think more people like you and me getting together and not being afraid to talk to each other. I think that's a good start. I think just education and trying to get some awareness out there. Thankfully, social media is a great tool nowadays. I mean, it seems to inadvertently have connected us. But I'd like to, I don't know, work towards a solution, really. But it's very encouraging to hear you speak after some of the people I've worked near and the way that they're doing it. It's very nice to hear someone saying it the way you're saying it, because I can agree with that. I can be 100% behind you with that in the way you're describing it.
I think that's good to hear, and that's sort of what the goal is. Of course, is we want to work together alongside one another rather than against one another.
Yeah,
Look, if I'm totally honest, I was a bit concerned when I saw your comments initially because they were quite strong and quite.
yeah,
Um, you were an adversary in the way that you comment is like, no, don't do this. Look at acupuncture
yeah.
and dry needling's the weaker version of the two, and that the
I've,
training's not
I've,
appropriate, and all of those things. Yeah,
I think the trouble is that actually we have a big problem with the BAAC right now, and their advertising has been pretty awful. I've seen actually some pretty disgusting even examples of needling as a picture advertising this course, um, and I think I may have misconstrued the two, and I didn't realize that your school was theirs. I think I was commenting on theirs at the time, or I thought I was. But it's very nice to see the clear difference and encouraging, really encouraging. Because people in my line of work can feel quite run down sometimes, and we do a lot of the acupuncturists I know care so much about people, and we do such good things for people, and that's what we're all here for at the end of the day. So, you know, as long as we're clear with our patients as to what is what, and I think education on both parts would help, because certainly, I would be happy to get behind if you were at my GP surgery, doing dry needling. I'd be much more happy knowing that a patient's been referred to you, rather than someone that I think may or may not distinguish the difference between acupuncture and dry needling, because I've had people that have seen people and then they've come to me because they had some dry needling, they didn't like it, so the physio said, why don't you go and see Gavin and try that, and then he explained that that this is just a small part of etc etc, and that's how it should work. But funnily enough, it's a funny industry to work in because it can be strangely competitive sometimes when it doesn't have to be. We're all here for the same goal.
yeah, definitely. And look, it's great to see that this kind of conversation happening, obviously, with us today. But we have the great privilege of we do occasionally have acupuncturists come and do our dry needling courses because they want to learn
Right.
a different perspective of the use of the needle.
Yeah.
And they all comment at the end of the course is like the only thing that we share in common is the tool that we use. The way that we explain and understand and intervene with our patients is vastly different. They are two different systems of care, and
Yeah.
that's usually the thing that they come to realize at the end of the course. And also the focus on anatomy. We spend 3 days in our practical training, but they'll spend dozens and dozens of hours with a theory before they get there, and then in the practical training they realize all they're really doing is an anatomy course. We spend so much time teaching how to do this safely and why it's safe, so that at
Yeah.
the end, the needle insertion, you can teach someone to put a needle in a few minutes. It's not difficult to do that safely. It's about where and how
Mm.
and why. Those are the key things that we need to sort of get across. And I think the
Yeah.
more conversations we have between purely Western and purely Eastern medical practices, the
Yeah.
better we both understand both sides of the coin. And they are both useful practices. They're both valuable. They both serve a purpose. I would refer people to an acupuncturist every day of the week for certain conditions. And likewise, I have acupuncturists who would refer to someone like me because they
Yeah.
might be able to get a more targeted approach at a particular presentation than an acupuncturist might, for example. Um,
Yeah.
but not because I do dry needling, but because I'm a practitioner of a particular
Mhm.
modality who also uses dry needling, and that tool is only selectively used when appropriate.
Right. Yeah.
Yeah,
I can understand. I can totally agree with that. Yeah.
yeah.
And I appreciate your wording, my friend.
That's okay. No problem at all.
Yeah.
Thank
Nicely
you for
done.
making the time to have this conversation, Gavin. Hopefully it's a useful one, not just for you and I to understand each other better, but also for people who are thinking of studying acupuncture or dry needling so they can understand the difference between the two. And for those people who are already practicing either of those modalities and being able to give greater degree of respect and understanding to the other as well, because I think that's key.
Yeah.
Yep.
Absolutely.
All right.
Yeah. And I appreciate your time, Shaun. I apologize for my harsh voice. I've been talking to patients all day. I'm now completely sick of the sound of my own voice.
I know the feeling. That's okay. No
But
problem at
thanks for your
all.
time. Good to chat. Hey,
Thank you. You too.
stay in touch.